One of Trump's first actions as president was withdrawing the United States from the World Health Organization. How will this impact the United States health policies, though? So here to break it down for us, we brought in Dr. Peter McCullough. He is a world-renowned cardiologist, and he is the chief scientific officer of the wellness company. Easy for me to say now. Dr. McCullough, you've been advocating for us to leave the WHO for some time. And you recently told Laura Ingraham that it's a money pit. Let's go ahead and watch that clip.
The WHO is a global money pit, is what it is. We have plenty of capabilities at the CDC. Our healthcare is not influenced at all by the WHO in the United States.
So how is this going to go, right? With the United States withdrawing from the WHO, how is this going to affect us and them?
It's going to liberate us. The WHO was advancing what's called a pandemic treaty alliance, international health regulations that would have constrained us and bound us to what the WHO wants to do with respect to plants, animals, humans. This involved farming, future pandemic response. And it was going to be binding by international law. And as I mentioned, the WHO is expensive. Billions of our taxpayer dollars went into this, and we weren't seeing the return.
How is it going to hurt the WHO? Because I'm okay with that. I'd like to see that happen. But does this damage them in some significant way?
It's about a 20% budget cut. And in the WHO's response back to Trump, it was interesting. They wrote a letter back to Trump and said, listen, we don't want to see you go. The United States has been in the WHO since 1948. And they said, listen, we've been trying to improve accountability and get cost effectiveness for the last 7 years. And I think Trump said, that's enough. Your budget's cut.
I look at this and I wonder how it would be different if we had a pandemic like a COVID-19 and we didn't have to worry about being in an organization like a WHO. How would that have played out in a different way?
If we would have been completely independent, and if other countries would have been independent, we would have seen a variation in terms of pandemic response. We would have seen the natural genesis of innovation. But because the WHO controlled all the communications through, remember, 193 member nations, over 140 national focal points, they gave the orders through the pandemic. And you remember these talking points that were issued on the same day, and they came out all over the world. One of them was, no one is safe. It came out on the same day. Another one about 18 months later came out, crisis of the unvaccinated. All coordinated by the WHO national focal points.
Won't be sorry about this one at all. Very happy to see that. Let's talk about RFK Jr. a little bit, though, because this is one of the headlines of the week, these confirmation hearings. There's a lot to unpack there. I was thinking today, if someone had told me a year ago, right, I think a lot of senators would maybe not have voted to confirm him. There's a lot of momentum right now. But what do you think about RFK Jr. and his qualifications?
Well, think about the context of this. We're 9 days into the new administration, shock and awe, 300 executive orders, pulling out of the WHO, ending government censorship, restoring the military. If they declined the vaccine and the vaccine mandates, they're being restored. And the list goes on and on. Now Kennedy, nominated for Secretary of HHS. Remember before him, we had Alex Azar, actually, who was installed under Obama, continued under Trump, and then Xavier Becerra under Biden. Do you remember any controversy or them going through their perfunctory hearings? No. The tension here is that RFK has popular support big time. That room is packed in the Senate, packed. And the senators all know that what's on the line for them, particularly those on the left, is the lobbyist money. And so they've been giving their talking points, make your statements, win points with your lobbyist support, and then try to go after RFK with everything you have. I don't think the public is buying this at all. They see right through it, and they support RFK.
Yeah, we saw RFK go back and forth with Bernie Sanders, and he said, you're one of the biggest pharma lobbyists,
Yes.
you take all that money, and he's like, only $1.5 million, right? There's 200 million. I don't take all of it, but it's so interesting to me because you see RFK and he is popular and he is having a moment, right? MAHA, Make America Healthy Again, is an entire thing that a lot of people in the Trump coalition were able to get behind during the campaign. So what do you hope to see him come through and change for America and the health system overall?
Well, let's just say that there's a lot of watchers. This is being broadcast everywhere. There are people watching this, reporting back to the senators and saying, listen, we're watching the body language here. There was cheers. People listened to Kennedy who spoke with great sincerity when he said, who doesn't want to see America get healthy again? So when he is confirmed, and I still think he has to get through, past that threshold, when he's confirmed, there will be great expectations, and he will assume basically a behemoth. There's over a dozen sub-agencies reporting in. We have the regulatory bodies, the FDA, research, NIH, CDC, huge budgets, lots of talent, but I think we can expect what he said in the hearings: radical transparency, accountability, and the end of corruption.
Accountability. Let's talk about accountability. What do you think his priorities should be in regard to the COVID vaccine?
I would like to see, the dream, although I don't know if the country has the will to do this. When I mean the country, I mean the people, as well as the medical orthodoxy. I'd like to see them remove the vaccines from the market. The pandemic is essentially over. The vaccines, no clinical trial ever showed a reduction in hospitalization and death. No valid observational study showed that. Now in the journal Science, Public Health Policy, and the Law McCullough Foundation has published, Nick Hulscher, first author, that there is a chorus of calls, I'm not alone, to have the vaccines leave the market now. And then we need to move on to other issues.
When you talk about accountability, we have to bring in Joe Biden and his presidential pardon that he has already given to one Anthony Fauci. I would love to dive into this with you because, one, the timing of everything, of the pardon, was interesting and of note. But what do you think could still happen in the health world that could still go through and have this reckoning for COVID-19?
Keep in mind, it was a preemptive pardon. Preemptive. Meaning that, a crime hasn't, been uncovered yet, but there is an intent from the Biden administration to provide this blanket coverage, essentially like what we consider a tail coverage. And it goes back 10 years. And 10 years is almost to the exact time when Obama put into place the ban of gain-of-function research. And I think this is going to be the big issue. 2 papers, Menachery, first author, Ralph Baric, senior author, where they describe the creation of primordial SARS-CoV-2. This is in the peer-reviewed literature, Nature Medicine, Proceedings in National Academy of Sciences. They say in these papers, they disclose it's gain-of-function research. It was started before the ban, and they believe grandfathered in. It was supported by Fauci and his branch, NIAID at NIH. And they thank Peter Daszak at the EcoHealth Alliance, now the debarred from HHS researcher, who shuttled the plans from UNC Chapel Hill to Wuhan, China. Now, even this week, the CIA agrees that the virus was engineered in the Wuhan Institute of Virology.
So do you know, because this is something we have people researching now. I have, as editor-in-chief at Blaze, we've done interviews with a number of people. I mean, obviously, you've been on this network a bunch. Richard Ebright did an interview with our managing editor a while back. There's going to be a show called The Cover-Up, will be coming out within the week, that's going to dive into this. But I'm wondering, like, the pardon is there. Let's give them the benefit of the doubt for a minute. The pardon is there, I guess they would say, because he might be unjustly prosecuted for crimes. This is the best case I could think of, for crimes that were committed during this 10-year period. So do we know what the punishments would be? I mean, what specific laws they're protecting him from? It's a tough question, but it would appear that it has something to do with illegal research. Is that right?
I think it's more broad than that.
Okay.
And recall that most of these Biden pardons were overtly stated that Trump was going to retaliate against people who sought to do Trump harm. Remember, Fauci and Trump never had discord.
Right.
To this day,
Right.
Trump has not said anything about Fauci. Now, there are books written about what happened and what Fauci's role is in this great controversy. Peter Bregan was the first one, then The Real Anthony Fauci by Robert F. Kennedy. Rand Paul has a paper out, a book on this out now. So it's well delineated. I think the mechanism would be a special prosecutor to investigate Fauci as a target, meaning that, as someone who's a perpetrator for two major crimes: fraud, that he misled the country intentionally on the origins of SARS-CoV-2, attempted to cover up the Wuhan Institute of Virology and his role in the creation of SARS-CoV-2. And the next big one was mass negligent homicide. Now, that's a big one. But by the mechanisms that Fauci worked to suppress all our efforts on treating people early and preventing hospitalizations and deaths early in the pandemic, and then he relentlessly promoted only one solution: mass vaccination.
With that in mind, Senator Ron Johnson has been all over this. He's been one of the good ones there in D.C. He subpoenaed HHS for the documents on the development and the safety of the COVID-19 vaccines. And some of that included emails back and forth with Anthony Fauci. So when you know what you know now, what do you expect to see in some of those communications that Anthony Fauci is likely going to have out there?
Remember, a lot of these emails are in the 500 and plus page report from the House Select Subcommittee on the Coronavirus Origins. Brad Wenstrup was the chair. And in these emails, you can see what they were doing. They knew they were breaking the law. They knew they were going to get in trouble. They were actually typing in code. So they would put a $sign or an ampersand in place of a letter. And David Morens, who is Fauci's understudy at the NIH, even mentioned the FOIA lady. There was somebody who worked in Fauci's area who knew how to deflect these FOIA requests.
Now, let's say that the pardon stands. I mean, there's a whole argument to be made whether you can preemptively pardon someone like this. That's a serious argument that we're going to be talking about, I think, at this channel for a long time. But let's say it does stand. Are there other means and other people that should be punished legally?
Well, remember, a special prosecutor would be federal crimes. There certainly can be civil cases brought forward. And other people in the conspiratorial team were not protected. So Peter Daszak, not protected and already implicated because he's been debarred from HHS funding. So there's already, a conclusion that, he committed wrongdoing. We have Ralph Barrick at the University of North Carolina, Chapel Hill. We have a whole conspiratorial team at the Rocky Mountain Research Center in Hamilton, Montana, where a 2018 paper came out and they had Barrick's virus and they were trying to get it to pass in Egyptian fruit bats. I mean, we could just go in the peer-reviewed literature and start to piece this together and say, wait a minute, the U.S. was knee-deep in coronavirus research that was trying to make it more transmissible and more lethal, and we got burned.
Last question for you. How likely do you think that it will be that we actually get real accountability on what happened with COVID-19?
I would forecast about a 20-year period of time. It's going to be very similar to the Great Tobacco Settlement. It's going to take that long a period of time because people are so deep into this now. They've staked out positions. Some have committed wrongdoing. Some have been on the wrong side of support. And it's very hard for someone to come out quickly and admit they're wrong and make things right.